If you've seen our TikTok video on ureaplasma and mycoplasma, and judging from this, most of you have, there have been a lot of questions about the specific vaginal infection. What is it? When do we test for it? How is it treated? And what symptoms does it cause? So vaginitis is an infection in the vagina and genitals which can cause burning, itching, pain, discharge, sexual pain, and burning with urination. All these symptoms are caused by any number of different infections, but most vaginitis is covered by one of two organisms, yeast and Gardnerella or bacterial vaginosis, which we covered extensively in this video here. Number one on the list of usual suspects is bacterial vaginosis, also known as Gardnerella. Most of the time when there is a discharge, it has an odor, a fishy odor, gray type of discharge. Bacterial vaginosis is the cause, and it's simply treated with either a vaginal or an oral medication called metronidazole or Flagyl. Recurrent episodes or resistant bacterial vaginosis may require treatment with canidazole or boric acid, but if it is recurrent, definitely see your doctor to rule out other infections. Next up is yeast or Candida. This typically causes a white, curd-like discharge and itching, but typically no odor. This is more common in patients with diabetes or autoimmune condition or systemic immunosuppression like HIV. In cases of recurrent candidiasis, those other conditions should be ruled out. Most yeast infections can be treated with an over-the-counter vaginal suppository or prescribed oral medicine. In some recurrent cases, we also use boric acid to treat yeast. In any case where over-the-counter treatments are not improving the symptoms, you need to see your doctor to rule out other causes of discharge, which are commonly gonorrhea, chlamydia, and trichomonas, which are all treated with antibiotics. And yet there are some cases where all of those tests for all those organisms are negative, and there are still signs of discharge, burning with urination. This can be caused by an organism called ureaplasma or Mycoplasma. Now, these organisms can actually be very common, up to 40% prevalence in the urogenital tract for both men and women. And so most of the time, you'll have these bacteria and they're asymptomatic. So we don't test for these organisms because most of the time, they're just an colonizer in the urogenital tract. Both ureaplasma and mycoplasma are sexually transmitted. In some circumstances, when there's a high bacterial load, they can cause symptoms like burning with urination, pelvic pain, sexual discomfort, and discharge. And when all the other organisms have been ruled out, we'll do a separate panel to test for these organisms to see if they're present. If they are present, they're treated with doxycycline or a macrolide like erythromycin or azithromycin. And if all of these tests are negative, there are other rare conditions, cancer, fistulas, foreign bodies, things that require a comprehensive workup by your medical provider. So don't put this off. I want to thank all of my loyal subscribers for helping support this channel and invite you to come on over to our short form content on TikTok and YouTube Shorts. You can check out the link below. While you're down there, if you haven't subscribed, become our latest subscriber and turn on your notifications.